Welcome to Children's Environmental Health Day.
Welcome to Children's Environmental Health Day. Happy Children's Environmental Health Day.
Welcome to 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 Children's Environmental Health Day.
Healthy kids and healthy places.
Healthy kids and healthy places.
Healthy kids in healthy places. Healthy kids in healthy places.
Healthy kids in healthy places.
Healthy kids in healthy places.
Healthy kids in healthy places.
Healthy kids in healthy places.
Healthy kids in healthy places. Healthy kids in healthy places.
Healthy kids in healthy places. Healthy kids in healthy places. Healthy kids in healthy places.
Healthy kids in healthy places.
Healthy kids in healthy places. Healthy kids in then healthy places.
Hold on, not yet. Ready? Go.
Welcome to Children's Environmental Health Day.
Welcome to Children's Environmental Health Day.
Ready, go.
Welcome to Children's Health Life Day.
You want to say, welcome to Children's Environmental Health Day.
No. What do I say again?
You can say, welcome to Children's Environmental Health Day.
Welcome to Children's Environmental Health Day.
Welcome to Children's Environmental Health Day.
Healthy kids, healthy earth, plant,
Places.
places.
Healthy kids and happy places. I don't know. Healthy kids and happy places.
Healthy kids in healthy places.
Healthy kids and healthy places.
Hi, good morning, everyone. Just confirming you can see me and hear me. So, although it always sounds much better and much cuter out of the mouths of kids, welcome to Children's Environmental Health Day. Today's Mount Sinai Pediatric Grand Rounds is a kickoff event for Children's Environmental Health Day and also the New York State
Can't get in.
Pediatric Advocacy Conference. And I'm really glad you're all joining us. My name is Lauren Zajac. I'm a pediatrician in the Department of Environmental Medicine and Public Health. And on behalf of our pediatric environmental health team, I am delighted to welcome you to today's events and to introduce our amazing keynote speaker, Aparna Bole. So every year on the second Tuesday in October, our environmental health community celebrates Children's Environmental Health Day, and this year is the 5th year. The event was established by a national organization called the Children's Environmental Health Network, or CEHN. And this annual event anchors the overall children's environmental health movement across the country and is a rallying point for diverse groups and organizations to take action on behalf of children's environmental health. And in New York State, we are lucky to have support from State Senate, State Assembly members, and the governor, who passed a resolution, which you're looking at on the screen right now. Sorry for the background noise, proclaiming today as Children's Environmental Health Day in New York State. And the Children's Environmental Health Network is a large, diverse, and very passionate network. And it really does take a village to ensure there's healthy kids in healthy places. And it takes a New York State village to raise awareness of children's environmental health and advocate for kids across our state for healthy environments and environmental justice. So I want to take a moment to thank just some of our village, and many of them are joining us today. So the New York State Assembly and Senate, and in particular, Assemblyman Godfrey, who you see on the screen, who has been such a staunch supporter for children's environmental health over the years. Also, of course, New York State American Academy of Pediatrics, AAP, chapters 1, 2, and 3, the New York State Pediatric Advocacy Coalition, and of course, our National Children's Environmental Health Network, who established CEH Day. Also, the Pediatric Environmental Health Specialty Unit Network, for which Mount Sinai is the Region 2 Center, our NIEHS P30 Center, and of course, our community partners, including Clean and Healthy New York, Just Green Partnership, Huntington Breast Cancer Action Coalition, the American Lung Association, among many, many others. And the New York State Department of Health and our state legislator for allowing us to become the first state in the country to have a network of children's environmental health specialty centers. And in New York, we're called the New York State Children's Environmental Health Centers, or NYS Check. And I just wanted to take a moment to say hello and introduce you to these partners across the state. Here at Mount Sinai, we're the New York City Center. We have a Long Island Children's Environmental Health Center located at both Stony Brook and Cohen's Children's. Our Hudson Valley Center is at Maria Ferrari Children's Hospital in Westchester. We have a Western New York Center at Oshai Children's Hospital in Buffalo, the Finger Lake Center at Golisano Children's Hospital in Rochester. The Central New York Center is at Upstate in Syracuse. And the Capital Region Center is at Duker Children's Hospital in Albany. And for many of you joining the call, this may be the first time that you're hearing of our work. And so as a statewide network, we're building the capacity of frontline providers and communities to address children's environmental health issues across the state. So we provide clinical services, consultations, education, outreach, community-based work. And so we hope that this session and the rest of Children's Environmental Health Day raises awareness. And we encourage you to visit our website, nyscheck.org, to learn more. And I have featured a couple of things which may be useful tools for your practice. So on the left side of the screen, you see the NYS Check prescription for prevention. We have a whole suite, more than 20 prescriptions, which are evidence-based action steps for families on the front, and on the back, links to community resources on a whole wide range of topics. And so by scanning that QR code, you'll be able to access all of these tools, which I hope you can use in your practice. And then also, I just wanted to highlight the CAP for Kids New York City site. Along with Dr. Leora Mogilner in the Department of Pediatrics, we have a project to address social determinants of health. And as part of that, we run the CAP for Kids New York City website, which provides curated and updated resources for families on a whole host of social determinants, including frequently updated information on COVID-related resources. So please take a look. Also, I just wanted to put in a plug. We also work with a lot of youth across the state, and our department is launching today volume 2 of our coloring book, which focuses on climate change in your neighborhood. If you would like to request a copy or learn more, check out the Sinai Children's Environmental Health Center social media links that are listed on the bottom of the slide. I mentioned before that Grand Rounds is really just a kickoff for a whole day celebration of children's environmental health. So our network, we have a great day for you. We have several sessions scattered throughout the day. And this is in conjunction with national activities through the Children's Environmental Health network. And so right after the grand rounds, we have a panel. We invite you to take a stretch break and then join us for the panel on climate and community resilience, followed by legislative action in New York. Okay, and so now for the main event, I am really honored to introduce Dr. Aparna Bole. She is the Medical Director of Community Integration at Rainbow Babies and Children's Hospital and an Associate Professor of Pediatrics at Case Western Reserve in Cleveland, Ohio. Dr. Bole is particularly interested in the intersection between environmental sustainability and pediatric public health and is very busy. She serves on many local and statewide lead and climate change and environmental health related coalitions and is the co-chair of the board for the group Healthcare Without Harm. And I've gotten to know Dr. Bole over the past 1.5 years. So she is the chair of the executive committee of the AAP's Council of Environmental Health, of which I was recently elected as a member. And in these really stressful, crazy times, Aparna is always a voice of inspiration and hope. And I've truly enjoyed working with her and learning from her. And I'm really glad you get to hear her speak on climate solutions for child health and health equity to kick off our Children's Environmental Health Day. So take it away, Aparna.
Thank you, Lauren, for the kind introduction. I'm going to attempt to share my screen right now. Can you hear me okay? Okay. Okay. Can you all see that? I'm getting a thumbs up. Okay. All right. Well, thanks again for the introduction, Lauren. I really appreciate that. And what an honor to be here today. Both, at this session that's hosted by Mount Sinai, which is home to so many of my personal heroes and sources of inspiration in pediatric environmental health, and with you, all of the partners across New York State. Your network of pediatric environmental health leadership is such an exemplar for so many of the rest of us. So it's really a pleasure to be kicking off Children's Environmental Health Day with you today. I have no financial conflicts of interest. I will mention a couple of nonprofits on whose governance boards I serve in my remarks today. As Lauren mentioned, I'm really going to be focusing today on climate solutions from a health equity lens and a community health lens. And I'm going to really try to keep my remarks focused on practical opportunities for pediatrician action around climate change and clean air. I think when I think about an equity lens for climate solutions, place is really important. So I'm just going to share a little bit about where I come from and how I got to where I am in my professional interests and commitment to climate action and health equity. I grew up in Portland, Oregon. So I don't know if we have any other Portland natives on this call, but if we do, you'll recognize a couple of Portland icons on this screen right now. These are my feet on the original Portland airport carpet. If people don't know about that, look it up. It's kind of iconic. And these new images of the new Portland carpet, I really don't understand. This is the original. And then the other icon here is Darcel. This is me with Darcel, who at 90 years old, I think is the oldest currently performing drag queen in America, another Portland jewel. And then here, these are my children playing on the Oregon coast, a little slice of the Oregon coast that was my favorite place growing up. I think for a lot of us who are Pacific Northwest natives, there is often this shared sort of connection with the natural environment. I feel like a concern for environmental stewardship was really part of my culture growing up. And that's something that really stuck with me, but it wasn't until medical school that I started to really connect some dots between environmental degradation and human health. And I also started asking some questions when I was on my clinical rotations about how the externalities we were creating ourselves in healthcare might be affecting the health of our local community. This happens to be a picture of smokestacks from a coal-fired power plant, a very old one that doesn't generate electricity. It actually just generates steam and chilled water. This was on the main campus of the hospital where I currently work, right behind our cancer center, one of the top polluters in our county. They have transitioned to natural gas pretty recently, but until pretty recently, these coal smokestacks were kind of at our hospital. So a lot of questions about the externalities we were creating in our operations. And, you know, both the sort of health system leadership and my pediatric mentors were a little bit confused about why I was asking those questions and why would a pediatrician sort of want to be in that space. So kind of got a little bit of pushback from both sides. When I was a senior resident, for my research project, I did a waste audit for the hospital because I was still sort of consumed with questions about what we were putting out into the environment from our hospital system. So I did a 24-hour waste audit. I actually collected trash, both regular trash and red bag waste, sorted through it. That's not me because I was fully gowned when I did it, but it could have been me. I was sort of sorting through the trash, weighing it, and got some attention from hospital leadership because it became clear we were throwing a lot of money into the trash. We were throwing things into red bags that didn't need to be there and paying for it to be processed. We were throwing things into the regular trash that either should never have been thrown away or maybe could have been recycled or reused or what have you. So got some attention around that and was able to sort of pitch the concept of doing some sustainability work in operations in our health system after my residency. But still, at that time, you know, I think both my pediatric mentors and my my boss on the operations side, it wasn't always clear to people how those different roles I played were connected. So I kind of felt like I was a clinician over here and an operations person over here. And initially, it felt like never the twain shall meet. You know, but I think as I started to practice in Cleveland, and really, you know, started to experience how children with asthma, the same kids with asthma would come back again and again and again because we were sending them home to an unhealthy environment. I was seeing kids from neighborhoods where more than 1 in 4 children are lead poisoned because of the living legacy of housing discrimination in Cleveland. The rates of pedestrian accidents in downtown Cleveland because we privilege often cars racing in from the suburbs and exurbs over safe places for children to walk and play. Just sort of asking a lot of questions about, you know, really how do those health disparities relate to environmental injustices in our community? Helped me to develop, I think, some more coherence around what really kind of lights me up now as a clinician and as an advocate, that really community-focused, equity-based climate solutions that are rooted in environmental justice seem really consistent to me, both as a primary care pediatrician and as a child health advocate. And that's my daughter, she agrees. This is last year at the Cleveland climate strike. She was on strike from kindergarten. So I've been thinking a lot about, reflecting a lot about history in this somewhat momentous year, 2020. It's the 50th anniversary of Earth Day. I've been thinking, you know, going back to my commitment to place and my interest in place, you know, thinking about the role of the Great Lakes in Northeast Ohio as a pediatrician in Cleveland in the birth of the modern environmental movement. A lot of you might know what the picture on the right is. It's sort of infamous. It's a picture of the Cuyahoga River on fire that was run on the cover of Time magazine in 1969. The picture was actually taken in 1952. And Cleveland was not, unfortunately, the only place where bodies of water were so polluted that they could catch on fire. But we just sort of had the dubious distinction of being the ones to be featured on Time magazine and are kind of forever remembered for that. The picture on the left is from the Lorax. Dr. Seuss was partially inspired to write the Lorax because of how dirty and polluted the Great Lakes were at that time in the late 60s. It was published in 1971. This is the part where the humming fish are seeking water that isn't so smeary. And the original line that came after that was something like, I heard things were just as bad up in Lake Erie. He changed those lines about 14 or 15 years later when Lake Erie underwent substantial cleanup. But, you know, I feel like these events are kind of remembered as dark marks in the history of Northeast Ohio and the Great Lakes, but I really view them differently. They were really we were the canary in the coal mine that woke up the country to the need for what is the modern environmental movement. And it was the year after this picture was published on the cover of Time magazine that Richard Nixon signed the Environmental Protection Agency into existence. Much has been made in our discipline about the fact that vaccine hesitancy finally made the top 10 list of global health threats that the WHO puts out every year. Well, air pollution and climate change has been at the top of that list for a very long time. As many of us know, the AAP has had for years a policy statement on global climate change and children's health that really outlines the health effects of climate change on children, explains how children are disproportionately affected, and describes our failure to take prompt and substantive climate action as an act of injustice to all children. Just to put a little bit of a finer point on the climate change clean air connection, climate change, of course, itself influences air quality as rising surface temperatures result in more surface ozone formation, and surface ozone can both cause and exacerbate chronic lung conditions and result in other health issues in children. But of course, fossil fuel combustion also directly affects outdoor air quality. And so oftentimes we think about outdoor air pollution, again, being a source of a cause and an exacerbator of chronic lung conditions like asthma, and that's true. It's well established that children who live close to point sources and also vehicular sources of air pollution suffer from more asthma exacerbations, and that even prenatal exposure to outdoor air pollution increases the risk of developing asthma in children. But we're learning so much more about the breadth of health effects of air pollution. It's not just asthma, right? We know that air pollution influences birth outcomes. It influences low birth weight and increases the risk of low birth weight and prematurity, both of which are themselves risk factors for infant mortality, which in Cleveland is a health crisis, as it is in many cities. I think in Cleveland, the disparity between Black and white infant mortality is the most disparate, the worst in the entire country right now. So if we're talking about infant mortality, we need to be talking about environmental justice. We also know that air pollution is a neurodevelopmental toxicant. There's a lot of emerging evidence in this space. Even prenatal exposure to outdoor air pollution can, and then exposure throughout early childhood and into the teenage years can affect learning, behavior, cognition, and even sleep. I think this is a pretty striking headline that air pollution might be the new lead. So again, in Cleveland and Ohio, we talk a lot about school readiness. What can we do to make sure that kids are ready for school, that early childhood development is as healthy as it can be? Again, environmental justice is a part of that equation. And so I've been talking about justice because we know that exposures to environmental hazards are not equitably distributed. We know that in this country, race is an excellent predictor of proximity to environmental hazards of all kinds, and disproportionate impacts of climate change and air pollution are really no exception. So just as one example, African-American communities are much more likely to be proximate to sources of particulate matter pollution, air pollution. We also know that as I said, vulnerable populations suffer disproportionately from the effects of climate change. Just as one example, I mentioned discriminatory housing policies in Cleveland. These historic so-called redlining policies where, as many of us know, in the New Deal era, minority communities typically were designated as red, being high risk for investment in housing and for home loans. So sort of the legacy of this systematic disinvestment in historically minority communities continues to contribute to health disparities of all kinds. For example, this study looks at heat island impacts. So exposure to extreme heat is worse in historically redlined neighborhoods today. And of course, more intense and extreme heat waves is one consequence of climate change. And the list really goes on. These are just a couple of examples. At the same time, in 2018, the UN Intergovernmental Panel on Climate Change, the IPCC, issued a report calling us to some urgency that we had about 12 years, so now about a decade, to take bold action on climate change to limit global warming to 1.5 degrees Celsius above pre-industrial levels, at which point ecological, economic, and health consequences become exponentially worse. So we're in a moment of urgency, and the UN also talks about this concept of climate justice. And the way they describe it is that climate justice is about looking at the climate crisis through a human rights lens. And so I talked about the disproportionate impacts of health effects of climate change on vulnerable populations. And another dynamic of climate justice is that those who are most responsible for greenhouse gas emissions that cause climate change and those who profit from it the most are not the same populations that suffer its effects the most. And then at the same time, we're also still in the grips of the COVID-19 pandemic, something that the WHO didn't foresee when they issued their top 10 list of health threats in 2019. And we know we're seeing sort of played out in tragic relief how the disparities in COVID outcomes are affecting our communities. So racial disparities in COVID outcomes are intertwined with environmental issues, right? We know that exposure to air pollution is a risk factor for worse COVID outcomes. We know that families who are disproportionately exposed to unsafe housing conditions during the quarantine also suffer from disproportionate health effects. And then another sort of intersectional issue is that, you know, this COVID pandemic, the economic impacts of the COVID pandemic also are not equitably borne, right? They're the pre-existing issues around housing insecurity, food insecurity have been exacerbated and with vulnerable populations disproportionately affected. This has really, I think, exposed the inherent vulnerabilities of the system that creates climate change and also creates these systemic inequities. So a system that's based on extraction, exploitation, consumption, and disposal is inherently vulnerable. Like look what we're experiencing with COVID-19. So on the one hand, it is heartbreaking, but I think it also sort of like paints a picture for us about the intersectional nature of climate action, health equity, environmental justice. That being said, so we have this chance right now to write what the post-COVID normal is going to look like. What is that new normal going to look like? But I think for pediatricians, it seems kind of overwhelming, right? Like, what does that mean? We're going to remake the global economy, dismantle systemic racism, create a more sustainable, regenerative, and just economic and social system. I mean, that's what we're saying, but what does that mean for us as pediatricians? So I'm really going to spend the rest of my time talking about opportunities for action, because I really believe that pediatricians, people who care for children, health professionals, really are uniquely powerful in this crucible of a moment that we're in to be part of just defining a new normal and really advocating for a new normal that is more just and sustainable, that represents climate solutions and health solutions. So I'm going to talk about advocacy, clinical practice, and health sector climate leadership as three sort of places where we as pediatricians and health professionals and those who care about children can make a difference. I'm going to start with advocacy. It's the issue of climate change, unfortunately, has become politicized and sort of partisanized to an extreme degree. And messaging about climate change has been studied. We know from, this is an example, this is a report from the Yale Project on Climate Change Communication and the George Mason Center for Climate Change Communication, where messages and messengers about climate change were tested across diverse populations. And this report really segmented the audience in the United States into 6 segments across a spectrum of, I'm really alarmed about climate change, I'm really motivated to do something about it, to really dismissive, like, I don't think climate change is a thing, it's not real. And then 4 segments in between. And a really interesting conclusion from this report is that health professionals, especially primary care physicians, are uniquely credible across all segments of the population. So whether I'm alarmed, dismissive, or somewhere in between, primary care physicians especially, and health professionals in general, are trusted by larger proportions of each segment and distrusted by fewer. So we have this unique ability to sort of cut across the partisan and political noise around climate change and really focus on health. I think another important aspect of our messaging as advocates is to focus on hopeful solutions. And the fact is, climate solutions are child health solutions. You know, I think about, what are the chronic health conditions that we're increasingly grappling with in primary care, right? Asthma, obesity, mental health issues. These are huge burdens on pediatric health, very difficult to grapple with and tackle in a 15-minute clinic visit, right? Very frustrating. But climate solutions truly are upstream interventions that reduce the burden of those chronic conditions. And that's why I talked a little bit about both the direct impacts on air quality of fossil fuel combustion and then the impacts of climate change itself. Because decreasing fossil fuel combustion by accelerating our transition to clean energy has immediate benefits in clean air. Sustainable, vibrant, inclusive cities that are designed to provide children with safe places to walk and play have immediate health benefits and planetary benefits. Investing in a safer, more sustainable food system, recommending more plant-forward diets are good for health and good for the planet. Another thing that gives me hope right now is that in this COVID crucible we're in, we've also demonstrated that we are capable collectively as a society, as humankind, in taking bold actions collectively together to protect one another. And I think that's a really hopeful sign as well. Another aspect, I think, of our power as messengers is to focus on what's happening to our patients right now in our backyards as a result of climate change. I think we still are suffering from that legacy messaging in the environmental movement about climate change being something that affects polar bears in the Arctic Circle 50 years from now. Another species, another time, another place. We as pediatricians have the ability to describe what's happening to children in our communities right now as a result of climate change. So for example, here in Ohio, air quality is a big issue in Ohio. What does it mean that my kids with asthma in the summertime, I have to tell them to look at ozone action days before they decide whether they can play outside? How does that impact kids' health that they can't go outside and play and do what they are supposed to be doing in the summer because the air is not safe for them to breathe? What about extreme heat? Longer and more intense heat waves. My student athletes are suffering with these longer and longer heat waves that we're having in Cleveland and at unusual times, deep into the fall. We know that if current trends continue, average summer temperatures in Cleveland will increase by 12 degrees Fahrenheit by the end of the century. We will have more than 60 days per year of over 90 degrees in Cleveland. What about extreme precipitation, right? The warmer atmosphere is holding more moisture. So when we have rain events, they are more severe. Already in the Midwest, extreme precipitation events, meaning more than 2 inches of rain in one rain event, are more than twice as frequent as they were a century ago. And what does that mean? This is a picture of toxic algae in Northwest Ohio in Lake Erie. When there are these extreme precipitation events in Northwest Ohio, there's agricultural runoff into Lake Erie, which has warmer average temperatures now because of climate change. And that combination is a perfect formula to encourage growth of toxic algae, which threatens the drinking water of children in Northwest Ohio every day. What about our growing zones? Changing temperature and precipitation patterns is threatening the livelihoods of farmers in Ohio, threatens our food system. Changing patterns of infectious disease. The expansion of the range of vector-borne diseases like Lyme disease is already affecting the Great Lakes and Upper Midwest. So we just have this unique, I think, opportunity to paint that picture. These are effects that I see in my practice every day. And because of that, and also quite frankly, because currently there are so many sort of barriers at the federal level around a rollback of regulations that protect clean air and act and mitigate climate change. Now more than ever, this kind of local level messaging and advocacy in states is incredibly important. And so we're seeing a proliferation of clinician groups who are dedicated to engaging the public and policymakers on climate change as a health issue. This is our Ohio Clinicians for Climate Action group in our pre-COVID advocacy day event at the State House in Ohio. There are groups like this popping up in states across the country. And actually within the AAP itself, we have climate advocates in every one of our 56 local chapters, all 50 states in Puerto Rico. How powerful is that? We have a network of pediatricians across the country who are ready to really speak up for how climate solutions will benefit the health of their patients. I'll give you some examples of how that can be really effective. Here in Ohio, a battle that we're fighting relates to a bill that would roll back energy efficiency standards and renewable energy standards, as well as provide taxpayer bailouts to coal-fired power plants in Ohio and elsewhere in the Midwest. A colleague of mine and I wrote this op-ed. She's a pediatric pulmonologist. We've also spent a lot of time in the State House and talking to policymakers. And I can tell you that having pediatricians talk about an energy bill in the language of child health like cuts across a lot of the partisan noise in our State House. We're received really differently than an industry representative or an environmentalist would be. We're able to really talk to both sides of the aisle in our governor's office to really ground this bill in child health. Our friends in Virginia have been, this is an op-ed written by a pediatrician in Virginia who is part of the Virginia Clinicians for Climate Action, and they've been very successful in advocating for clean energy policies in Virginia. Our colleagues in California are advocating for climate smart policies. These are a pair of pediatricians writing an op-ed about climate change affecting health of kids in California. They've also more recently been incredibly powerful storytellers about how climate change fueled wildfires are affecting their patients and their work. The Medical Societies Consortium for Climate and Health is a collaboration between medical professional societies that all have either a policy statement or position paper on climate change as a public health issue. AAP is one of the founding members. One of the things the Medical Societies Consortium is doing right now to really leverage the power of these local stories is to collect them in these little mini video vignettes that are shareable. We have a growing collection of stories from pediatricians and other clinicians from around the country describing in very short vignettes how climate change is affecting our patients. And hopefully this really resonates and helps to bring home what a local and immediate issue climate change is. Just a quick rundown of some federal policy priorities right now that AAP is pursuing. As I said, currently, unfortunately, there's been a trend towards significant rollbacks in clean air and climate change related protections. So just a little potpourri of things that we're advocating about. One, the rollback of the methane rule, which regulates methane pollution from oil and gas fracking, which causes local pollution, as well as being a potent greenhouse gas. We're advocating against that rollback, advocating against the rollback of the mercury and air toxic standards in collaboration with the American Lung Association and many others. Big issue for us here in Ohio, mercury pollution is a big deal in the Great Lakes, so we're fighting that. We oppose the rollback of the Clean Power Plan, which is, as many of you know, regulates carbon pollution from coal-fired power plants. We are fighting for the strengthening of the National Ambient Air Quality Standards, which govern ozone limits. And on a positive note, the House has a select committee on solving the climate crisis that just released sort of its policy roadmap after months of hearings and input. And the AAP was a big part of contributing to making sure that child health is really centered in that policy roadmap. The AAP's pre-election toolkit that as usual highlights key child health issues in this critical election year. This year includes climate change and clean air as one of those top issues and really grounds a lot of the messaging and guidance for those who care about child health in the language of health equity and how climate change and clean air advocacy and policy advances child health equity. I'm going to switch gears from advocacy and talk a little bit about some things we can be doing at the bedside in our practice. As I mentioned, climate solutions are health solutions from a policy lens, but climate solutions are also health solutions at the bedside a lot of the time. And so I'll just give you a few examples. One, active transportation, right? Like talking to families about kids being able to walk to school, bike to school, walk or bike to recreational spaces, recommending that, and then also working with families to find opportunities to do that safely or to advocate for those if they don't exist, like safe routes to school, walking school buses, complete and green streets initiatives taking place here in Cleveland might be one example. So active transportation, good for physical health, builds social cohesion, good for the planet. Plant-forward diets. Most American diets are too rich in red meat, right? And for a lot of families I take care of, one of the biggest ticket items in a family's food budget might be red meat. And so having those conversations from a place of cultural humility about plant-forward diets being a strategy to both benefit kids' health often can be good for our pocketbook if families are operating from a tight food budget, and also great for the planet. We, in our practice, do a lot of assessing families' unmet health needs that may not be medical, issues around food insecurity, housing. One example that comes up a lot is utility insecurity. And actually here locally, our utilities are starting again with shutoffs. There was a moratorium for the pandemic and shutoffs have started again. So we're often asked to sign those medical forms to defer utility payments. So one thing we're trying to do in our practice is really provide some wraparound services for families suffering from utility insecurity. How do we prevent that from recurring? One important strategy is working with our city and county to connect families with home weatherization and energy efficiency resources. It's important because it keeps their utility bills down, keeps their home more comfortable and climate controlled, also good for the planet. I would also submit that we have a lot of, I think, power in being able to connect the dots for families about climate change and clean air in their child's health. So why is it that allergies seem to be getting worse in Cleveland year over year? Why is the allergy season so much longer and more intense? It starts earlier, it ends later. Why is it that these longer and more intense heat waves are hitting us and at weird times of year, later and later in the year? What is happening with these extreme precipitation events? How does it relate to climate change, and how does clean air affect our health? I think that's important not only for patients and families, but also when working with our community partners. You know, in my community health work, I work with community organizations quite a bit. One example I mentioned earlier are outrageous disparities in infant mortality here in Cleveland. I work with groups in the community who are passionate about addressing those disparities, really grassroots organizations from Cleveland who are focused on maternal and child health. Well, connecting the dots with our community partners, like let's infuse an environmental justice lens into part of that equation when we're advocating for health equity for our babies and moms when it comes to maternal and infant health outcomes. And I can tell you it's made a difference. You know, we're learning to speak one another's language when we work in partnership with community stakeholders. And this one group that I'm thinking of that I work with closely on improving birth outcomes and advocating for policies that improve birth outcomes has changed their language to start talking about clean air and healthy environments. And it does make a difference. So I think we can connect the dots both at the bedside and with community partners when we work on issues related to health equity. Finally, I'm going to talk a little bit about the health sector. The health sector is a huge contributor to climate change. If the global health sector were a country, it would be the 5th largest greenhouse gas emitter on the planet. And the United States health sector represents an outsized part of that. If the US health sector alone was a country, we would be in the top 10 of greenhouse gas emitters. This is from a report that's linked here from Healthcare Without Harm. Not only that, the health sector is an important part of community climate resilience. So for many reasons, like we have a role to play here. We can make a difference in leadership around mitigating climate change. And then our contribution to climate resilience is important as well. When we think about how is it that the health sector contributes to climate change, I mentioned our own climate footprint is about where we live, where we get around, and what we eat. That was sort of the graphic I was trying to capture in talking about counseling opportunities at the bedside. Similar in the health sector or any other sort of industry, buildings, transportation, and what we buy, and including food. So when we think about a hospital, energy use is a huge contributor to climate change. And just like most commercial buildings in the United States, most hospital and healthcare facilities waste a significant proportion of the energy that we use. So win-win-win, we save money, we save energy, we do something good for the planet. We produce a tremendous amount of waste. Are we being mindful about that and how we're processing it? What are we purchasing? Where do we purchase it from? What do our menus look like? You know, do we have plant-forward menus? Where does our food come from? What's our transportation footprint and how do we mitigate that? So we have some opportunities. The OR is also specifically highlighted here, and it's worth pointing out that waste anesthetic gases are a potent greenhouse gas. And this is another win-win. Capturing waste anesthetic gases, good for the planet, good for our bottom line. So for every one of those gray clouds, there's a green cloud here that represents an opportunity for action in the way that we operate. And I will say there's a lot of what we can do relates to how we operate the buildings that we have and how we purchase and what we purchase. But I will also say that the way we think about healthcare delivery itself can be viewed through a climate lens. right? Because the more intensive hospital-based care we provide, the more sick care we provide, the more resource intensive it is. The more we invest in prevention and the prevention of disease, the more we transition from a sick care to a well care model in our health sector, the more climate smart we're being, and it's good for people too. So when I think about the power of the health sector, not only are we a huge contributor to climate change, we are a huge economic engine in the United States and around the world. And collectively, we can really move markets and be climate leaders. The Healthcare Without Harm convened several years ago a climate council of health systems from around the country, it's still growing, who are committed to climate leadership, are committed to being on the forefront of transitioning to climate smart healthcare. Many of these have made commitments around climate action that are quite bold. For example, Rochester Regional right here in New York State made a commitment to run on all renewable energy by 2025. That is a pretty amazing commitment. I know NYU Langone has a LEED Platinum certified main campus, and also certified through a program called PEER, which relates to power system efficiency, resiliency, and reliability. And they're a PEER Platinum and LEED Platinum facility. There are many others on this list who have bold climate action goals. Gunderson Health System already runs on all renewable energy. Kaiser just came out with an announcement about carbon neutrality. So their strength is growing. And if we think about their collective impact, the Climate Council represents hundreds of hospitals, millions of patients served, 1 million employees, over $200 billion in annual operating revenue. Collectively, how powerful are they to be able to move markets and lead the health sector towards climate action? At the end, I'll mention there's some work going on at Mount Sinai, and I'll mention that at the end as well. So talking about our economic power in the health sector, I want to dive into that just a little bit more. Oftentimes, health systems and hospitals, right, are among the biggest employers in a city or a state. We purchase a lot, we hire a lot, we are a major employment centers and drivers of economic activities, but also commonly we are located in communities that are historically disinvested. And you have this dynamic of our ivory tower hospitals being located in communities that are suffering from the living legacy of housing discrimination, who bear the brunt of environmental injustice, who are suffering from health inequities. This is definitely true in Cleveland, not unique to Cleveland, but just to give you a sense, I'm going back to my focus on place. So UH, my health system, Cleveland Clinic, Case Western Reserve, and many other cultural institutions in Cleveland are located in a neighborhood called University Circle. Greater University Circle neighborhoods is the term that we use to describe the surrounding neighborhoods, which are historically redlined, disinvested, and predominantly Black neighborhoods on the east side of Cleveland. If you overlay any health outcome, infant mortality, lead poisoning, you name it, maternal morbidity, these neighborhoods suffer from some of the worst health outcomes relative to surrounding communities as a result of that living legacy of housing discrimination and other forms of discrimination in the city. Recently, Cleveland, well, this is a few years ago now, just like we weren't the only city to have a river on fire, we're certainly not the only city for which zip code predicts health outcomes better than genetic code does. But we had the sort of dubious distinction, I guess, of being the poster child a few years ago in an HBO special that compared the health outcomes or the life expectancy between a wealthy suburb called Lyndhurst and a community called Huff, which is right here in Greater University Circle, about 8 miles away, and found that there was a 24-year life expectancy between those neighborhoods. So we convened what was called the Greater University Circle Initiative with the help of the Cleveland Foundation several years ago to try to figure out how could we leverage our incredible economic power and our operating dollars to build inclusive wealth in the neighborhoods we serve. How could our economic activity be used to dismantle some of these inequities, systemic inequities in the neighborhoods surrounding us, and do that in a climate smart way? So it's this very intersectional approach between economic justice, health equity, climate justice, climate solutions. It's really sort of a way of bringing those together in a way that is very action oriented. And so we focused on a few areas for impact. We called them live local, hire local, and buy local. So that would include things like housing incentives for living locally to main campus, Hiring local, working with HR to really be intentional about building an employment and career pipeline for people living in communities local to our main campuses in Greater University Circle, buying local, spending our dollars locally as well. And we call this an anchor institution initiative. We're going to talk a little bit more about this, I know, in the panel following the session. But what we mean by anchor institution is we are significant engines of economic activity, and we are rooted in our communities. We are not a company that is going to just pick up and move. So our hospitals, our institutions of higher education, our city. So our anchor institution collaborative in Greater University Circle included University Hospitals, My Health System, Cleveland Clinic, Case Western, and the City of Cleveland. Just one example of an outcome that was created through that collaborative is this worker-owned conglomerate of businesses called Evergreen. They're focused on sustainable business models, leveraging our purchasing dollars as anchor institutions and creating worker-owned, so these workers have equity in these companies, worker-owned companies that draw employment from Greater University Circle and focusing on folks with employment risks. So these might be people who've never held a job. It might be individuals who have a history of incarceration, really creating like a workforce development model here. And the businesses that exist with Evergreen right now include a laundry, which is pictured here, a greenhouse, a hydroponic greenhouse that's right in the middle of downtown Cleveland, which is pretty awesome, actually. They grow like lettuces and herbs and they sell them all over the region. And then also an energy company that I'll get to in just a moment. There's a growing network of hospitals and health systems really leaning into their role as anchor institutions to take this really intersectional approach to local, climate smart, economically just solutions that leverage their economic power to build wealth in their surrounding communities. It's called the Healthcare Anchor Network. It was convened by the Democracy Collaborative, and today there are 50 hospitals as part of the Healthcare Anchor Network with over 1.5 million employees and a purchasing power of over $50 billion annually. Again, we'll talk about that a little more in the next hour, but this is sort of that growing trend of leaning into our role as anchors. I'm going to give you an example in my own practice and work of another sort of result of this sort of ethos of the way we operate, being a tool for climate solutions and health solutions. This is the new home for my practice. This is our Rainbow Center for Women and Children. It's where our residents in pediatrics have their continuity clinic. It is also an outpatient OBGYN practice. Our midwifery clinic is here, high-risk OB. We have a number of other programs housed here. We didn't want to make this just a building, but also a catalyst for inclusive economic development in the part of Cleveland where this sits, which is Midtown, and I'll talk about that in just a moment. We convened a community advisory board that consists of stakeholders from a diversity of organizations across sectors, from housing to mental health to faith-based to education, as well as everyday people, patients, families, and neighborhood residents from Greater University Circle to give us input about the design of the building and its programs. That group continues to meet today. We also worked with our local transit authority to make sure that this is an exceptionally transit accessible spot. It is accessible by multiple modes of transportation. It's exceptionally energy efficient. There are solar panels on site. It has really stringent indoor air quality standards, stormwater management features in its landscaping. It is a LEED Platinum certified facility by the US Green Building Council. There really aren't that many of those in healthcare. It's the only one in Ohio. And I love that and this is in Huff. So in that neighborhood that was featured in the HBO special. So I love that the greenest healthcare facility in Ohio is in a community that has been the recipient of generations of economic or environmental injustice. These are the solar panels. They're here and then they're also on the roof, and they were installed by Evergreen. So just an example, a little bit of a full circle example. We insisted that Evergreen Energy Solutions would be the installer of our solar panels so that this worker-owned cooperative is the one that installed this really big project. They generate 50% of our building's energy demand, which is pretty awesome. Okay, just real briefly, this is where we're located. I'm really focused on place today. Midtown is the name of this stretch of Cleveland. The hospital's main campuses are over on the right side of the screen. Downtown Cleveland is on the left side of the screen. This comprises neighborhoods that are described as Greater University Circle neighborhoods. It is this boundary is sort of in between downtown and our main campus. And our new center is this red star. And like I said, we wanted to not just be a building kind of plopped down in Midtown. There's a lot of development happening in Midtown. And we wanted to be a catalyst for inclusive development in Midtown that would result in a walkable neighborhood, an economically diverse neighborhood, a neighborhood whose development was going to benefit the longtime residents of Greater University Circle by building wealth. I'm going to talk about this more in the next hour, so I won't dwell on it, but I just will mention one example of a concrete outcome. We worked with a local supermarket that was looking to build a new location. This is a historically sort of a food desert neighborhood. This new supermarket is actually located right next to our clinic. We got our community advisory board together with this supermarket to make sure that it was an accessible source for nutrition, but also education about nutrition for our community. It resulted in the construction of this teaching kitchen. We use it, our dietitians use it, our patients use it, our community partners use it. Our practice is right over here. You can see it through the window. It's just an example of some of the programming that takes place there. So we're thinking about how can our center be connected with other partners to build a neighborhood that contains amenities that is accessible to the people who have always lived in Huff and surrounding communities. And like I said, I'll talk about that a bit more in the next hour. In conclusion, I just want to offer a hopeful message. I said at the beginning, I talked about the Lorax and Lake Erie and that river on fire. And as I said, I don't view those as dark marks in our history at all. I think they were a wake-up call that gave birth to the modern environmental movement and also represent some of its greatest successes. So this is Lake Erie today on the left, one of the jewel of Cleveland. This is right in downtown Cleveland, Edgewater Park. And then on the right is the Cuyahoga Valley National Park today. And its biodiversity is a real testament to one of the great successes of the environmental movement 50 years later. So I really do feel hopeful at this moment, this sort of turning point that we're faced with in deciding what we want our post-COVID normal to look like, that we can design a more just, sustainable, equitable, and climate smart new normal. And I think that we as pediatricians and health professionals are really powerful in making a difference. I would just like to thank you again for your attention and also acknowledge Jessica Wolf from Healthcare Without Harm. I used her slides with permission and others who helped me a lot with understanding what was happening in New York around climate smart healthcare, including the Democracy Collaborative. And this is the contact information for the sustainability lead at Mount Sinai, Christina. She may be on the line. If she is, I hope she'll introduce herself either, I don't know, in the chat, or maybe she can just introduce herself in the Q&A. So, and I'll stop. These are some of the resources that I referred to during my remarks. Thank you again. And I know we just have a couple minutes, but if there are questions, I'm happy to answer them.
Thank you so much, Aparna. What a wonderful talk. At one point, we had over 175 people tuning in to hear your inspirational words. And I look forward to continuing this conversation with my colleagues here at Mount Sinai and through New York State Network. If anyone has a question for Dr. Bole, please put it in the chat. And also I would invite you, if your schedule permits, to stay on for the next hour in the same link where we're gonna have more discussion with Dr. Bole and others about climate resilience and what we could do. Let me see. Any questions? Or I think really it's hard virtually to do a big round of applause, but I'd just like to acknowledge how wonderful that was. So, virtual round of applause.
Thank you. I appreciate that. I really appreciate your attention, and I know we're about to break for our next session. So I'm also happy to have anybody contact me if there are questions. I know it is hard in the virtual format sometimes.
And Dr. Bole, this is Maida Galvez of Mount Sinai, and I just want to say that you are truly redefining what it means to be a community pediatrician. It's pretty amazing to witness. Thank you for, really showing us a roadmap for change and the force of change that a clinician and a pediatrician, a primary care pediatrician, specifically can be, and you're an agent for transformational change that we all want to see. And I couldn't have thought of a better way to kick off our Children's Environmental Health Day celebration today. Thank you. Every time we hear you speak, we literally are cheering. We just love hearing you. So thank you for joining us today.
Thank you. Thank you. I'm really honored to be with you, and I'm looking forward to the next hour of conversation. Thanks so much.